In the name of God, I told you salam again, and I continue this part of the lesson about the rectus sheath. This is a transverse section in the abdomen. Here is rectus abdominis muscles in the two sides. Here is skin from anterior. This is superficial fascia. This is external oblique abdominis muscle. The blue is the aponeuros of external oblique abdominis muscle. Come to the anterior of rectus. This is internal oblique. This is the aponeuros. The aponeuros of internal oblique, when arrive to rectus, divide to two layers. One layer come to anterior, another layer goes to posterior. And this is transverse abdominis muscle, and this is the aponeuros going to posterior of the rectus. Here is a 2/3 of superior part of the rectus. That here we have anterior to the rectus sheath. This is named rectus sheath, anterior layer of rectus sheath, and in the posterior we have posterior layer of rectus sheath. This means in the 2/3 of the superior of the rectus, anterior and posterior surface of the rectus has sheath. In the anterior sheath we have one layer and half layer. One layer from external oblique aponeuros, and half layer is anterior layer of aponeuros of the internal oblique. In the posterior we have one layer, one complete layer from transverse abdominis muscle aponeuros, and half layer. This is posterior layer of internal oblique. And here you can see linea alba. But this anterior and posterior rectus sheath, in the anterior we have one layer and half layer. In the posterior sheath we have one layer and half layer. This is only for 2/3 of superior of the rectus. But in the 1/3 of inferiorly, the sheaths are like this picture. The external oblique aponeuros come to anterior. The internal oblique aponeuros here do not divide to two layers. Here is only one layers that come to anterior of the rectus, and transverse abdominis thus come to anterior. Thus, in the 1/3 of inferior rectus, we have three layers of aponeuros in the anterior, and rectus sheath has anterior layer of sheath. But in 1/3 of inferior, the rectus in the posterior don't have any sheath, because all of the aponeurosis come to the anterior of it. In the 1/3 of inferior rectus in the posterior, we have only fascia transversalis and extraperitoneal connective tissue and parietal peritoneum. I hope that you understand what I told you. In the 1/3 of inferiorly, only we have anterior rectus sheath, and we don't have any posterior rectus sheath here. Now we are going to another part of the lesson. We are going to clinical notes here. Here is the umbilicus. In the umbilicus we have many superficial veins. These are that they are like a head of the fish. This is caput of medusa. These veins going to drain to the portal vein. But when we have a disease in the liver, or we have a obstruction in the portal vein, the blood accumulated in this vein surrounded the umbilicus, like here, and here is the caput of medusa. Here is named portal vein obstruction and caput of medusa, like this. In the normal person, we cannot see this vein in the abdomen, because in the normal person, blood in this vein is very, very decreased, and we cannot see this vein. But when we have pathologic condition like this, obstruction of portal vein, the blood, the venous blood accumulated in these superficial veins, and these veins going to dilation and can be seen like this. This is a disease. Another is maybe in the rectus sheath we have hemorrhage when we have blunt trauma here, like in the person that going to play football. In this condition, maybe the inferior epigastric vein bleeding, and here we have many pain here. This is hematoma of the rectus. In many cases, the inferior epigastric vein is turned, and we have the hemorrhage from the inferior epigastric vein, and rarely we may have the hemorrhage from the inferior epigastric artery. You know, in the rectus sheath we have rectus muscle, and we have two artery and veins. One artery is the superior epigastric artery, and another artery is inferior epigastric artery, and the vein is superior epigastric vein and inferior epigastric vein. All of this in the rectus sheath. You can see another shape here. Here you can see here you can see here, if this it is going to you can see I am going to project it. You can see here is the inferior epigastric artery in the rectus sheath, and here is superior epigastric artery in the rectus sheath, and here is not shown the veins that is committance with this artery. We are going to another we're going to another file for explaining about clinical notes. I ended this file, and in the future file we continue. Thank you for your attention.